Which side are you on? Which side are you on? For more than half a century, Laguna Honda has been good to heal the sick back to health in this neighborhood.
Stop the closure. My name is Steve Zeltzer, and this is a crisis. This is an emergency crisis that we face here. And literally thousands of people need care. The nursing home industry is in a catastrophic situation, bad conditions. And what we're saying here is the reason people are dying and being discharged into homeless shelters where they're not taken care of, over 9 people have died, is because there isn't a place to go. This is the last resort. And this is a public institution which is a treasure for the people of San Francisco. So we're going to have a number of speakers here from labor in the community, and we're calling on the mayor, we're calling on the Governor Newsom, the Department of Public Health, to withdraw this closure order. We're calling on Xavier, Becerra, the Department of Health and Human Resources, to withdraw the discharge. They should not be making discharge orders and closure orders knowing that people have no place to go. People have no place to go. That's a reality, and that's why 9 have died. So our first speaker is Lisa Milos, Elizabeth Milos, who is a member of UPTE, United Professional Technical Employees, UCSF, also a delegate at the Labor Council. Welcome, Lisa.
My union, University of Professional and Technical Employees, CWA, passed a resolution during its previous convention on July 31st, opposing the closure of Laguna Honda Hospital. My union represents 18,000 workers in the University of California, as well as 3 community colleges. We are a public sector health and education worker union, and we have social workers as well, some of whom are here as well with us, who have patients that get sent to Laguna Honda Hospital. The message that I would like people to understand is that privatization kills. We cannot be fooled by this attempt at closure of a perfectly viable institution that is set, according to latest news, is set to be recertified in January, yet vulnerable patients are being transferred out unnecessarily and are dying. We cannot be fooled that this closure on this prime real estate in San Francisco has any other intention than to privatize this land. This is a public resource that is, as Steve Zeltzer pointed out, is the only place in San Francisco that accepts patients that are on Medicare, the only skilled nursing facility that accepts patients on Medicare. I will tell you a personal account of mine where my grandmother back in 1996 suffered a stroke. She was 85 years old. She lost the ability to speak as well as some mobility. If not for the treatment that she received during the approximately 3 to 6 months, 3 months that she was here by the trained personnel here, she would not have regained full motion, full mobility, and full cognitive function. So I will be forever thankful to her, to Laguna Honda Hospital and its workers for providing that level of service, quality service that saved my grandmother and allowed her to live until she was 91 years old. So what I want to say is that it's time for healthcare workers to get together from all the different unions and all the unions to support each other in this endeavor in stopping the closure of public resources. My union passed a resolution demanding an end to the closure and an end to cutting off the beds by 120. We presented this resolution at the San Francisco Labor Council. Unfortunately, due to a lack of quorum, it could not be discussed, but we did speak with the leadership at the San Francisco Labor Council, which told us that they were just as concerned that they would not permit this to go on as well, and that there is going to be a pending rally with the workers of SEIU and the workers represented by the San Francisco Labor Council to also oppose this closure as well.
As I said, this is one step of many. There needs to be thousands of people here to save this facility and to make it sure to the politicians it will not be closed, it should be expanded. It should be expanded because we need the kind of health care and support that this institution provides. So our next speaker is Brenda Barros, and she is SEIU 1021 chapter president of the General Hospital. Now, these facilities, General Hospital, all these facilities need to work together. And what we're saying here, let's bring together all healthcare workers and the community residents to defend Laguna Honda. So welcome, Brenda.
What I want to say is we've been hearing rumblings, and I represent the employees who work in this building, the ones providing the care. They do it here, they do it at San Francisco General, they do it at healthcare clinics. We are all dedicated to the public. We want to give the best care. But if you talk to employees at Laguna Honda, they will tell you there are many times where they have gone to management about different issues, and they've gone unaddressed, and so here we are. So what we want to do is send a message out to the public. The public employees cannot do this alone. We can't save Laguna Honda for you alone. We need all of the public to be calling their senators, to be calling their congressmen. If you know somebody at the White House, you call whoever you have to, because we cannot lose Laguna Honda. There is nowhere else for people to go. I have a friend of mine who's a co-worker out at General. Her mother needs Laguna Honda, but guess what? Now she's on a waiting list. Now she can't find anywhere for her mother to go. And it's causing a lot of trauma within her family. So this cannot be allowed, because people are involved in all of this. People are being harmed when there's no bed at Laguna Honda, and they're not rich, and they can't afford to pay a private duty nurse to come to their home and take care of their mother. And that's who we're talking about. And that's most San Franciscans are not able to do what I just said. They're not able to pay cash and have somebody come to their home and be a private duty nurse so they don't have to worry and they can continue to work. So please, I'm calling to the public, please, the government needs to hear from you. I know I talk to people all the time who say that they do not support Laguna Honda being closed. They're outraged at what has happened. But I'm saying don't be angry with the employees, because it's not their fault. They didn't create this mess. So now we have to save it, and the employees, and I know they brought management from San Francisco General over here to try to fix this, and I know those people are good people, and I'm sure they're doing everything they can, but they need the help of the public. They need the public to speak out and support. And they need to hear it from you, because it's very demoralizing working in this type of environment and not hearing anybody supporting you. All you hear is negative things. There's a lot of positive things still happening at Laguna Honda today, even though everybody's focusing on the negative. But all those negative things are being worked on. So please, public, we need your support. We need you to speak out to your supervisors and everybody else and let them know we cannot lose Laguna Honda under any circumstances.
Thank you, Brenda. And as we all know, there is a healthcare emergency in this city and in this country. And one of the things that we have to protect are the community healthcare centers in San Francisco. And our next speaker is the vice chair of SEIU 1021 Community Healthcare Centers, which are threatened with privatization. We need community healthcare. We need to help the people on the streets of San Francisco and the residents. So welcome, Cheryl Thornton.
Good afternoon, everyone. My name is Cheryl Thornton, and I am a SEIU 10-to-1 member, as well as the vice president of the Community Health Chapter, as well as a Labor Council delegate. And I am not born in San Francisco, but I was raised in San Francisco, and I've seen the change. And we cannot lose Laguna Honda. This is part of a bigger picture of privatization and gentrification. But it's also corruption, because we are attacking the people who are the most vulnerable in San Francisco and reducing services. Laguna Honda is a public facility, the only one in the nation this large. And so to privatize this is like part of the gentrification of San Francisco. Low-income people who have strokes or need to be rehabilitated or so forth need to have a facility like this in San Francisco. When my dad was sick with cancer and needed a facility, at the time we lived in San Bruno, I could not find a suitable facility, and he was not eligible for a facility like this, and he was a dentist for the city and county of San Francisco. Many of our city workers use this facility when they get sick. So I am asking the powers that be to not close this facility, to do whatever you can to save this facility, to not take this land and privatize it and put more expensive condominiums. I know the land in San Francisco is very valuable, but we need people from all walks of life to be able to live in this city. So please stop the corruption that's happening here at Laguna Honda. Stop the closure, because this really is corruption. So thank you.
This is a critical issue, and it's not something that just started. It's been going on for decades. One of the other aspects of the issue of privatization and the attack on public services has been at City College, which is a working class institution for black and brown working class kids, and it is threatened with closure as well. In fact, they've already closed campuses, and they sold off the city. The Board of Supervisors and the mayor sold off the land at Balboa Reservoir to a private for-profit developer to build condos. How many more million-dollar condos do we need in San Francisco? I would say we need working class housing. I would say we need more money for education. Yet education, public education, is being threatened. And our next speaker is Michael Lyon with the Higher Education Action Team, which has been organizing to protect City College so all working class kids have a right to go to a great public school. Welcome, Michael Lyon.
Everybody knows Laguna Honda is this irreplaceable resource. There's nowhere where poor people on Medi-Cal can go in the city. I worked at San Francisco General for 15 years. And I saw 3/4 of the psych beds on the 7th floor being closed. I watched the crises in which the city wanted to reduce the tax burden on corporations, and so they cut back on services. At one point, they were going to close half of the neighborhood health centers. It's just absurd. This whole crisis that we're seeing now is about profits and capitalism. The reason that there's no place for Laguna Honda patients to go except out of city or out of state is because the board and care homes got bought up by private developers for expensive housing. And that's because the city let the luxury housing developers come in. They welcomed them. The reason that the private hospitals in San Francisco aren't accepting Medi-Cal patients is because they can make more money from acute care. So these private hospitals just don't take poor patients, and the city lets them get away with that. So this whole thing has to do with profits and capitalism. And it certainly has to do with what's happening at City College, with trying to close it down without trying to privatize its services out. For instance, the aircraft maintenance program. It's closed at the airport. They're trying to move it into Bayview Hunters Point, where it would just add even more pollution to the toxic environment there. And they want to sell it off to a private thing. We need to get rid of capitalism at the same time that we're fighting these cuts to our health system, our education system, and we can do that. We can learn from these fights that we're engaged in now, to learn to trust each other, to learn to trust ourselves instead of these politicians who are really handmaidens. I mean, right now, the city officials are trying to blame the feds for closing Laguna Honda, but it was the city officials who refused to supply the services for people with mental problems or substance abusers. They refused to supply those services. So people became people freaked out and they needed to be hospitalized, but they closed the psych beds at San Francisco General and they sent them to Laguna Honda because it was cheaper. Laguna Honda was not equipped, not staffed, and not set up to be able to take care of them. And now you have the chickens coming home to roost. Thank you.
My name is Joe Aliotto Veronese, and I'm actually a candidate for district attorney here in San Francisco. And you may be saying to yourself, what is this guy up here doing up at Laguna Honda? I have actually been a part of the fight for Laguna Honda since the late 1980s. When I stood here as a kid and my mother, Angela Aliotto, stood on these very same steps, fighting this very same fight to keep this hospital alive and serving the people of San Francisco. It is a critical resource to the people of San Francisco, and the fact that we are standing here today fighting for this resource shows that there is a deficit in leadership in San Francisco that truly doesn't understand what's going on the streets of San Francisco. You would have to be living in a hole not to understand and to see on a daily basis the mental health and the addiction issues that are being lived out on the streets of San Francisco. We have a health department here in San Francisco that is not addressing and giving the level of care that the people of San Francisco deserve, that the people of San Francisco expect. And the fact that we're up here today, not as a press conference, but as an act of activism, demanding that the leadership of this state and primarily of this city stand up and say, we are not going to allow this to happen. We are going to open the beds. We are going to give the people of this city this resource that they deserve so that it doesn't bleed into the criminal justice system, which we see happening. Criminal justice reform, believe it or not, starts here. If we let this resource go, we fail the people of San Francisco, and we'll end up seeing more of it on the streets of San Francisco. Regular citizens, the hardworking labor citizens of San Francisco demand it, and that's why I'm here today. When I heard that this was happening, I said to myself, 30 years later, I've got to come back. I have to be a part of this fight, because when I'm your next district attorney, I need to make sure that when I hold the Department of Health accountable, when I hold the mayor accountable for what's going on in the streets of San Francisco and the mental health and the addiction issues, that there is a place of care that they can go to, a resource that is San Francisco as San Francisco should be. We need to fight to keep it open. I want to thank you for allowing my voice in this very important fight. Let's fight this on.
This is a community issue, it's a worker issue, and also it's a patient issue. And the patients here need to be defended. Many of them cannot speak for themselves. That's why they're here, to be taken care of by professional healthcare workers. Our next speaker is Joseph Urban, who has been...
Thank you, everybody. So I started the petition. We are well over 1,600 people at the moment. This is my wife, Carrie, and it's her mother, Betty Campbell. That is a resident here. We'll be visiting her later today. So I wanted to just have everybody recognize that we got a big win a couple weeks ago when they did a pause, CMS did a pause on the transfer and relocation process. But I do want everybody to recognize this is simply a pause. And I want you to look at the numbers. If the numbers are correct, between 5 and 9 people have died. And when you look at the number of people who were actually transferred that were skilled nursing people, about 45. That's almost 20%. 20% of people who are transferred via this process have died, and we're simply on a pause. It could restart. It could restart any time now. And there's no official medical diagnosis for transfer trauma. Transfer trauma is what killed these people. And so we don't have a lot to fall back on to say, well, let's figure out exactly what causes transfer trauma. We know that 20% of people have died. And we have up to 450 more people in that category that are exposed to transfer trauma. We could have up to 80 people additional dying if this keeps up. Are we going to let that happen?
No. No.
No.
Are we going to let our government do this to us?
No.
In that building, there are 80 people who are about to die. We got to stop that.
That's right. Stop the transfers.
Got to stop the transfers.
Stop the closure.
This is a tragedy caused by our government. With all the good intentions they have to regulate properly, these individuals have set a lot of people up to die. It's our job to stop it.
They're speaking for the patients who are not able to speak for themselves. That's what we're talking about. That's why families have come together. How many people signed the petition? 1,600 people, 1,700 people signed a petition. The patients here, the residents here need the help of the people of San Francisco. They need the help of the community. They need the help of the workers to survive. We're talking about a question of survival for these patients and residents. So our next speaker is Art Persico, and he's with the Great Panthers.
Thanks, Steve. I'm speaking on my own behalf today. I think this is a failure of government at all levels. You know, we don't take care of each other, and every level of government has something to say and something to do about this. This institution is a rare and valuable thing. It's a public long-term care facility. It's a precious San Francisco community resource whose employees are well-trained and dedicated to care for us when we become vulnerable to the ravages of age and disability and qualify for these services. It's an institution financially supported by us all through our taxes, through Medicare and Medicaid money. And we in San Francisco, as evidenced by the people here, are intent on doing everything we can to, in our power, to protect the future and the present of Laguna Honda Hospital. When it has problems, as any large institution will inevitably have, we in San Francisco expect our government to solve these problems and allow this valuable institution to move on to function and continue to meet the needs of San Francisco's vulnerable, elderly, and disabled residents, rather than put its residents at risk by unnecessary transferring them to places not suitable for their health care needs, resulting in trauma and even death, as we've seen. We need to keep Laguna Honda Hospital going rather than shut it down according to inflexible, counterproductive, and blind federal rules that, to the extent they do, lack sense and compassion. We need Laguna Honda Hospital to be there for any of us, for any of our family members and or our fellow San Franciscans who might need them in the future, who might need Laguna Honda Hospital in the future. We in San Francisco need Laguna Honda Hospital if we want a safe, public, long-term care facility which actually cares for us without prioritizing a bottom line over the proper care. Without Laguna Honda Hospital, and we need more such places here in San Francisco and all over the country, any of us who need such care are at risk of being reduced from the status of human beings with rights to health care and instead are transformed into customers, and I would say victims. We are, in that sense, unwilling pawns of businesses that superficially appear to be dedicated to our care, but which instead are taking taxpayer money from Medicare and Medi-Cal, and in many cases due to an overriding business mentality that prioritizes profits over optimal care, they're not providing that care adequately. If we have the misfortune of going into a for-profit nursing home, we become victims. If you look carefully at the data, this institution has provided very safe and good care over the years, especially when you compare it to the private nursing home industry that's in it for the profits. So we call for a stop to the attack on this public institution. With the support of the public and the cooperation of all levels of government, from San Francisco to the state to the federal government, let's fix any problems Laguna Honda Hospital has while we keep Laguna Honda Hospital open so it can continue to keep its residents safe, cared for, and healthy. And so the option of a public long-term care facility in San Francisco is preserved now and in the future for the common good. Thank you.
Thank you, Art. And we have to say, San Francisco is one of the richest cities in the world. There are over 80 billionaires in San Francisco. and they tell us they don't have the money to take care of Laguna Honda, to keep Laguna Honda opening and open more beds up, something is wrong. And this crisis is not just about Laguna Honda. As I said, over 10,000 people in nursing homes died during the COVID thing who shouldn't have died because the workers were not protected and the patients were not protected. And why weren't they protected? Because it was for a profit industry. And we're calling on the Attorney General, Rob Bontas, to start going after these people who control the healthcare industry in California. They're profiteers, and they're making money on the deaths of the patients, the deaths of the people they should be taking care of. Our next speaker is Charles Minster.
Charles Minster. I'm a member of Senior and Disability Action, which of course is foursquare behind keeping this facility open. Remember that the taxpayers of San Francisco paid over $500 million to build this state-of-the-art facility over here. This institution has been here 154 years. It's similar to facilities that were set up in Europe after the Crusades to take care of the injured and infirmed and the wounded, that even have to this day still go on as hospitals. So this is not unique to the world, but it's pretty close to unique in the United States. Although my mother died in a facility like this in Baltimore that was set up after the Civil War. The private industry doesn't want skilled nursing facilities because they can't make enough money off of it, pure and simple. I visited this hospital many times to visit patients, and excellent care, quality care, in the old facility and in the new facility. This is, as people have said, this is a land grab, and this is a pretty valuable piece. But that hospital is the jewel, and they'd love to get a hold of it, cut the staffing to the bone, and probably get the government to raise the Medicare and Medicaid rates so they can make more money. So remember now, 9 people have died that have been transferred out of here, and who's ever behind the transfer, giving those orders, is guilty of manslaughter, pure and simple. No reason you take a 80-year-old person that's disabled and infirm and carry him out of a home that they might have been in for decades. Some of these people have been here for decades. But that's this government. Profit before care. And then remember, this is a Democratic Party administration from Washington, D.C. to Sacramento to San Francisco. Remember that. What are their priorities? Arms to Ukraine and sending Pelosi to Taiwan to give the finger to China. Pelosi, this is on her bailiwick. She sent a representative here when we first had there was a big rally here about 3 or 4 months ago when the threat came down. She didn't do shit. She was too busy running off to Taiwan and doing other things like making sure that the military expenditures were passed in Washington, D.C. We are not a priority. She hasn't spoken to the public personally to have question and answers in decades. This is the kind of representative she is. More concerned with her stock portfolio than she is with our care. So we need a new direction, like the brother said earlier, because capitalism is the enemy. And we need a party of our own, a party of the producers, not the exploiters, to change the direction of this country. Thank you.
Yeah, we're at 1,642 or 3 right about now. So I encourage everybody. It's on change.org. It's a long URL, so it's kind of hard to say it here and get everybody to do it. But if you do any Googling on any of the articles that have been written, more than likely there will be a link. So the Chronicle, the Examiner, they've all done articles on this topic in Laguna Honda, and there's plenty of links available there. But let me, if I could, maybe I'll give you a... Yeah, it's so the title of the change.org is Stop the Forced Relocation of Residents from Laguna Honda Hospital. And this is directed at Xavier Becerra. It's also directed at the Chief Medical Officer of CMS. The reason why I did that is because that guy's a doctor. Should care. Should care about the quality of care. Doctors have a Hippocratic oath. If they ignore their Hippocratic oath, their position as a doctor should be put in jeopardy. And I'll say this too, that any doctor in any of these administrative roles, chooses to prioritize recertification over the care and the health of the patients in Laguna Honda, then they are also jeopardizing their role as doctors as well. Do no harm. That's their oath. Not get it recertified. We understand that's important. It's got to happen, but not at the expense of lives. There's no reason to kill people. We could thread this needle. We could do it, but we can't kill people. We got probably 80 people in that building about to die. So we got to make sure the doctors who are in charge as well, that they recognize that this is unattainable.
Well, thank you all for being here. So this is a song, Which Side Are You On? Okay, so which side are you on? Which side are you on? Let's hear it now. Which side are you on? Which side are you on? One more time, let's get a little practice. Which side are you on? 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 For more than half a century, Laguna Honda has been good to heal the sick, get back to health in this neighborhood. But these days we have a crisis. Managed care ain't coming through for the very folks that it once served. What are advocates to do? Which side are you on? 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 How do we get Sacramento and SF supervisors too to pay attention to this crisis? We advocates know what to do. Let's stop privatizing public services like charter schools are doing, draining funds that help society, or just who they think they're fooling. Which side are you on? 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 Get care to the least among us, who will live their lives with belief that the prior generation cares for them and gives them just relief. Our $1 billion surplus, the flow of public money, ain't going to who it's supposed to serve. Bad oversight and management, it ain't funny. Which side are you on? Oh, which side are you on? Which side are you on? Now, which side are you on? So how do we get Sacramento politicians to pay attention? We gotta use our voices here now and get some real intervention. Let's use our voices here and now to get folks what they need. Dignity, care, and recreation, that will be our creed. Which side are you on? Which side are you on? Louder now. Which side are you on? 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 Which side are you on?
Also, I wanted to announce that Do No Harm Coalition at UCSF is also supporting this. And we're going to continue this campaign organizing drive to get the entire working class in all communities to support this struggle. We want to keep this institution going. We want to make it stronger. We want to expand the beds, not reduce the beds. So more working class people, more people who need health care that they provide here can get it. So I want to thank you all for joining us. Solidarity. Keep this institution open. Keep Laguna Honda open. Thank you, brothers and sisters.
Stop the closure.